Doctors have been alerted about a new unknown illness that's been seen in children.
We think may be caused by coronavirus.
When I was training to be a paediatrician, we learnt about a condition called Kawasaki disease. It's rare, but nasty, with the child having a severe rash, peeling skin on the hands, inflammation of the arteries, a strawberry red tongue, and sometimes heart damage. I only ever saw one child with Kawasaki disease, and no one had a clue what caused it. Almost as rare is toxic shock syndrome, usually linked to a bacterial infection, again with a rash, as well as blood pressure that can crash fatally. On the face of it, neither illness should have anything to do with SARS-CoV-2, the virus that causes COVID-19. But in recent weeks, children's doctors in the UK have suspected a connection.
We've seen a handful of children who've had an unusual pattern of disease. So they either have persistent inflammation, so fever for quite a few days, associated with abdominal pain in many children, and some of them having quite profuse diarrhea, and then quite often having rashes or red eyes, which is the bit that sounds like the syndrome called Kawasaki disease, which is quite a rare thing. And then worryingly, some of them becoming shocked.
Dr. Liz Whittaker is an infectious diseases paediatrician. She's been treating children showing these symptoms and was one of those who raised the alarm.
We spoke to colleagues in other centres in London and the UK who'd also seen a couple of cases. And because of that, and because we're in the middle of an outbreak, it was reasonable to think that they might be related to COVID-19.
As each week passes, this disease increasingly shows its true face. It attacks all ages and the whole body. And that in turn makes the search for a treatment both more urgent and more challenging.
A couple of the children who have had the shock that I described have had myocarditis, and that's where your heart is also a little bit inflamed. That was quite similar to the adults with COVID-19, which is, I think, part of the pattern that alerted us to think about it in the first place. I'm actually having teleconferences today with colleagues in Italy, Spain and France, all of whom have individually reported similar cases. I don't think this is unique to the UK. I think that we've possibly just raised it sooner because of our reporting system.
To put this in perspective, there have been fewer than 20 kids reported with these complications in the UK. While Dr. Whittaker and her paediatric colleagues in London prepared for the worst from the pandemic, they were actually left with empty beds.
We've given over a large number of the beds in our children's intensive care unit to adults, and my colleagues and I have rapidly reminded ourselves how to look after adults. They're not just big children. It's been really inspiring that so many people have been flexible and worked hard together to try and limit the impact of this pathogen on as many people as possible.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.